All right, what's up, everyone from PESI? My name is Craig Lindell. I'm a doctor of physical. I'm a physical therapist. Have my doctor of physical therapy. You can see it there in the background. That one always trips you up. But today we're going to be talking about targeted and effective interventions for lower back pain. So, just a little intro. Let's redo that one, right? So, my name is Craig. I'm here at Rehab headquarters. I'm in the treatment room. And today we're going to be talking about minimize, do not catastrophize when it comes to low back pain. So, I got to give credit when credit is due. This comes from a newsletter by Crossover Symmetry, great folks. And they put this out a few weeks ago. And we learned about this when we were in school. But at the same time, I was like, wow, what a great reminder. And something that we practice all the time as clinicians when we're working with patients here at the office on a weekly basis, and even myself. So I just ran my first marathon less than 2 weeks ago. And leading up to the marathon, there's nerves, there's anxiety. And on one of my last runs, my left IT band really became a problem. And immediately I begin catastrophizing. Oh no, am I going to be able to run the marathon? What is it that I'm going to do? How am I going to be able to handle this? So that's what I want to talk about today with the example of low back pain. Because the reality is, low back pain is probably the most common ache and pain that people deal with throughout the entire world, especially in the US. There's a lot of stats and statistics to support that. But we always deal with low back pain at the most inconvenient time. And it's always the amount of pain that is super inconvenient. It sucks. It puts a damper on your life. It messes up your entire normal routine from the minute that you wake up until you go to sleep. So let's talk about what this model is. So minimize, do not catastrophize. What we're looking at here is the catastrophize model. So say that it's an injury, or say that it's even pain. What that leads to is a painful experience. So, say that you actually hurt your back. You bent over, you felt a pop, felt sharp pain, something happened. You're not exactly sure what happened or what is injured, but you know that something happened. Immediately, now all your efforts, your conscious thought, your focus, and your attention is focused on that injury, is focused on that pain because it's a stimulus. It's thrown off your homeostasis and your body's reacting versus what we're going to focus on with the minimized model is how to respond. So this is even bigger than low back pain, but how can you teach your body to respond versus react? But again, let's go back to it. So injury or pain happens, you have this painful experience and your body is mentally, physically, and viscerally responding to that painful experience. So if you bent over and it hurt your back, now every time you go to bend over, you feel that painful experience. You experience that back pain. And now you begin catastrophizing. So, what's a good example of this? They're catastrophizing. They think it's the end of the world. They're not going to be able to do anything because of their low back. Now they can't even bend over and pick things up. How are they going to be able to tie their shoes? How am I going to be able to put socks on? How am I going to bend over and pick something up if something fell and I had to pick it up? How am I going to go about my day at work? It's you get in your own head is the easiest way to describe it. So catastrophizing, you're focused on it, you're not being in the present, you're just becoming obsessed with the worst scenario possible. And this is what I like to call the valley of despair. Right after an injury or once you're in pain, you fall into this valley of despair where you're no longer optimistic, but you're pessimistic. And the glass is half empty, it's no longer half full. And the glass is leaking. It's going to be the end of the world, right? What does that lead to? All that leads to is fear of movement or fear of another injury. What if I keep bending over? Am I going to make the pain worse? If I keep bending over, is the injury going to get worse? Am I going to need surgery if it keeps hurting? Well, what if I stop moving and the pain is still there? What if I stop moving and the pain stops? Okay, well, now I'm associating not moving with not experiencing pain. And you can see how that's going to lead to a fear of movement or fear of injury. Because now, under normal circumstances, you've bent over thousands and thousands and thousands of times in your entire life. But this one time, for whatever reason it might be, you felt pain or you injured your back. So does that mean that now 100% of the time you're going to associate that movement with fear or associate it with an injury? Well, someone who is catastrophizing, that's what they're likely to do. And it's just not a good mindset. But it's easier said than done, right? So if I can go back to my own personal experience, I was running, I felt pain with running, and now I feel pain with stairs. I feel pain with walking. When I'm not moving, I don't feel any pain. But now when I go to get up and move, I'm tense. I'm I'm thinking of what's going to happen, right? It's this prediction error. I'm predicting that I'm going to be in pain when I go to take a step, when I go to walk. Or in this scenario with back pain, I'm fearful and I'm predicting that I'm going to be in pain when I bend over. All that leads to is avoidance or compensation with the way that we're moving. Now I'm super tense. I'm not going to move as I naturally would if I'm going to pick something up off the ground. And I'm going to do it differently. I'm going to be way too in tune with what's happening and focus on the tiniest sensations. And I'm curious if it's going to make things worse, or is that good? Is that bad? And then all that's going to lead to is disability, disuse, and depression. There's so much science and research to support that. The more that you move, the more that you do the things that you enjoy doing, and you're having positive experiences with those movements or those experiences, you're going to be a happier person. And more importantly, you're going to use your muscles. If you don't use it, you'll lose it. And that's where disability can come into effect. And ultimately, you fall into this vicious cycle of the catastrophizing or the catastrophized model. So it's not a good model. Unfortunately, it's a very common model that a lot of people go through, especially if they are dealing with pain or experiencing a new pain that's related to a new injury that they haven't dealt with before. From experience, this model tends to happen with someone who's never experienced a big injury in their life. And it's typically their first time experiencing a big injury, or it's their first time experiencing this type of pain. And it's just a natural human response. I mean, we all kind of freak out sometimes and we react versus responding, especially when it's something new. I mean, think of something within the last week that has happened to you that has never happened to you before. Your heart jumps in your chest, your heart rate is now going faster, you can feel your blood pressure, you can feel the temperature on your skin increasing, and you go into fight or flight mode, or you go into this catastrophizing mode, or you do both at the same time, right? It's because our brain, it's always constantly doing error prediction. It's trying to predict what is going to happen. And the more error that your brain is unable to predict or plan for, it expends more energy and it puts your brain into a spiral of thinking too much and thinking the craziest things. We do it all the time. So instead of the catastrophized model, we can focus on minimizing. And what I'm going to do is I'm going to update this board to reflect what the minimized model should be. So we're going to erase all this stuff. Hopefully I can do it without pulling out any cords or doing anything crazy. I knew I should have brought a different eraser. So again, we just reviewed the catastrophized model, and now we're going to move on to the minimized model. So what does the minimized model look like? So instead of catastrophize, we got minimize. We're going to become optimist. The glass is half full. It could be worse, right? So you have an injury, or even let's call it a pain. You bend over, something doesn't feel good in your low back. Okay, well, now what do? Well, you're going to experience pain or experience discomfort, an ache, pain, discomfort, whatever you like to call it. Now you're slipping into the valley of despair, but what do? Are you going to react to it? Are you going to catastrophize? Or are you going to be present, accept what your body is feeling, accept what your body is experiencing, and accept it for what it is. And this is where you do not catastrophize. Catastrophize. So many different examples of this, right? Well, what if you bent over and it didn't feel good on your back? Instead of freaking out and thinking that you really injured something, that you need to go see a doctor, that you can't bend your back anymore, that you need to stiffen up, that you need to take medication, that you need to get an x-ray, that you need to get an MRI, well, maybe your body is just trying to send you a signal. Your body is trying to send you a message. And it's saying, hey, this is sensitive. I don't want you to do this anymore because the more that you do it, the more sensitive it is. And it's just a matter of kind of accepting that and respecting it. So, okay, I'm respecting the sensitivity of this. So instead of catastrophizing, I'm going to limit the amount of times that I need to bend over, or I'm going to change my strategy with how I'm bending over. If something falls on the ground and bending in my back hurts, well, can I keep my chest up and can I kneel down to the ground? Or can I squat wide and keep my chest up? Because 4 plus 3 is the same thing as 5 plus 2. There's different ways to get the same result, just using a different method. And that's sometimes what our body needs to do. When I was dealing with all that IT band, my office is upstairs. Every time I went up and down the stairs, it hurt. And then I was just trying to figure out, well, what can I do? Can I use my arms on the railing? Or can I go really wide going up and really wide going down? Can I go fast? Can I go slower? Instead of catastrophizing, what I did was I went into problem solving mode. And I said, okay, how can I do this without experiencing the pain and discomfort? Because that isn't what I want to experience. And then what that is doing, instead of catastrophizing, you're not drunk. See, that wasn't even planned. I bent over, had to pick up a pen, and my back is okay because I was optimistic. Instead of catastrophizing, what you're going to do is you're confronting it. You're facing it head on. You know, one of my favorite books is The Obstacle is the Way. When bending over hurts, well, can you confront that and can you be okay with that? And can you find ways where you realize that, okay, eventually I'm going to have to be able to get comfortable with bending over again. So if bending over sitting down hurts, well, what about if I bend over and I'm standing? Okay, that hurts. Well, what about if I bend over supporting my body with my arms? Okay, well, that still doesn't feel good. Okay, well, what if I lay down on the ground? What if I lay on my back and try to bend over? Does that help? Or what if I lay on my stomach and I try to bend over? That's all rehab is. It's actually kind of simple if you think about it. You need to confront whatever it is that you're dealing with, and that's going to lead you to recovery. At prehab, myself, my colleagues, we're all pretty biased when it comes to you got to use it. So there's therapists out there, or there's a lot of thoughts where it's, hey, you need to load it, or you need to massage it, you need to do manual work, we need to needle it, we need to stimulate it. Honestly, I think that we just need to use it. So use it as much as you can, listen to your body, be present, but more importantly, confront it every single day. And when you're confronting it and when you're in recovery mode, you need to focus on microdosing. So let's say that bending over hurt your back, and now instead of being able to bend 10 times without it hurting, you can only bend about 3 times before it starts hurting. Okay, well, I'm going to bend, I know I need to bend once in the morning, and then in the afternoon, I'm going to try to bend 3 times. Okay, does it feel good? Can I bend once more? And I need to get back to where I was. I could bend 100 times in a day. Right now, I can only bend 3 times. Okay, I'm going to bend 3 times as many as throughout the day, as much as I can. The next day, okay, now I can bend 10 times. And let me bend 10 times and just microdose it and confront it. And more importantly, it's just being positive, is being really optimistic, right? Because we want to avoid that disuse. We want to avoid that disability. We want to avoid depression. Having that optimistic mindset and using it is going to make you feel so much better in your low back or whatever it may be. So if we were to recap, we talked about minimize, don't catastrophize. And There's so many examples of this. We talked about the low back. I talked about the running one where I dealt with IT band pain leading up to my marathon. But this goes for any injury or any pain that you are dealing with. So the next time that you feel pain, the next time that you get injured, instead of freaking out and thinking about, well, how is this going to change my life later on in the day or tomorrow or during the week or with the activities that I enjoy doing or my job or responsibilities? Can you just be present in that moment and accept that something has happened? It could have been worse, but at least you're able to still do certain things where you're confronting it. You're kind of learning, okay, well, now what is my new baseline? What is it that I'm actually able to do versus I can't do anymore? And then if you need to be able to do the things that you can't do because it hurts too much or you injured it or something broke, well, how can you begin confronting it every single day? And you can confront it with microdosing movement and using it is going to work your way to recovery. So this lecture was really focused on targeted and effective interventions for lower back pain. I do want to show you some exercise examples in a moment. But even before we get to the exercises, I want to take a peek at if there's any questions from anyone in the audience. So now is a great time dropping questions if anyone has any questions. Otherwise, what I'm going to do is I'm going to share my screen here. And I want to share with you our video library. So for the professionals out there, we do have an exercise library, over 3,000 exercise videos. And right now I'm taking advantage of our tags. So we have over 300 tags. We have simple tags. We have more advanced complex tags. I've set it up where it's just low back and mobility. And for instance, standing lumbar extension, cat-cow, full spine, where you're moving into extension. Here's another extension exercise variation on the ground. Here's another extension exercise variation. So the reality is that we're talking about using it, microdosing it. So it's finding ways to get back to what your goal is. So if you want to get to 10, right, you can do 5 plus 5. You could do 4 plus 6. You could do 1 plus 9, 2 plus 8. Maybe 4 of the 5 of those aren't working. Well, if that's the case, okay, well, find the one that works and repeat it and do it every single day and just microdose that. So we have a special offer for that through PESI. So take advantage of the promo code that is in the chat box, and then you'll get an extended 30-day free trial to check that out. So with that being said, there's a ton of research and evidence on this as well. And then there's actually, I believe, at least one, if not a couple articles dedicated to this model. And it's great, especially if you're dealing with an individual who has a history of catastrophizing. I mean, it's a certain type of person that does this, right? Like either you're calm, cool, and collected if something hurts, or you freak out because you're not sure what's happening and how's it going to affect your life. And if you're able to, as a professional, identify who those individuals are, and if you can meet them on their level and kind of talk them off a ledge, that's gonna be therapeutic in itself. Versus maybe trying to force exercises that they're not ready to do. Versus someone who doesn't catastrophize, maybe you can be a little bit more aggressive getting them to move on day one. So hope you enjoyed it. Hope you learned something. Thanks for tuning in, everyone from PESI, as well as everyone from Instagram. Sorry it was backwards, but we'll continue chatting here. All right, everyone.